Good morning. I am Dr. Othonos Athos, and this is the 37th lesson, International Homeopathy lesson, about classical miasmatic constitutional homeopathy. We are going to present a case once again, and as you can see, we have to do with a very with a case that has many notes, many rubrics, many words of the patient, many answers of the patient, the exact words. It's a first characteristic. As always, I present and analyze cases taken by my students at their early stage in order to have many clues, many notes. And the main aim, is to be able to translate, to interpret what the patient says into rubrics and into valuable information about his miasms and about his constitutional characteristics at the state of clinical health according to allopathy, or at the state of chronic illness according to homeopathy. Let's follow our scheme, the order of the procedure. First of all, we just read the case, read the notes of the doctor who took the case, just to get a general idea, just to get a glimpse of the whole. Secondly, we proceed to see the background of the patient, his personal data. Then we see for what reason he comes to us. And then we try to decide what is the miasmatic synthesis of the patient. What's the prevailing miasm or miasms? Then we try to find the essence of the patient, the main idea, the core of his picture, and then we examine possible constitutional pictures that are similar to the patient, and then we do differential diagnosis. I deliberately choose typical cases that don't need much differential diagnosis in order to give you the correct picture of the constitution that affects the patient. If I analyzed at this first step cases that need thorough differential diagnosis, then you wouldn't match in your mind the typical picture of the constitution that we talk about. So the procedure is, during these lessons, to describe to you the typical picture of a certain constitution, and then to examine a case that is typical, that has a person that is influenced by this typical constitution and has the typical constitutional picture in order to have a good and perfect match. In the future, we are going to analyze more complex cases and give much more attention to differential diagnosis between similar constitutional pictures. Now, let's just read roughly the notes of the doctor. Male, 53 years old, dentist, married, 3 children, 24 years old, 19 and 17 years old, 162 centimeters height, 69 kilos weight, not fat, not very thin. He comes to the doctor because of anxiety and insomnia the last 20 days after the death of his father, who has been suffering from a chronic illness and has given much trouble to his son, to our patient. He says, I had so much to administer during the last days after the death of his father. I wake up 3, 4 o'clock in the morning thinking about daily affairs. He also says that lately he has, as he says in his own words, many crises of irritability. He means that when he is pressed, he has this crisis of irritability, although he doesn't easily express his anger, he expresses it only to his own. 3, at grade 3, only to his own. Then we go on. He wears heat 1, wears coat 1 to 2, offensive sweat 1, irritability 1 to 2, as the doctor evaluates. And he explains, he asks what makes him angry and how if he expresses his anger or not. He gets angry when adverse conditions happen. An example, when not finding things where he put them, yet he is sloppy at his office, at his work. Nevertheless, he pays the bills as soon as they come. I get angry easily, yet don't express myself, don't want to intrude myself into contradictions. So in the end, I sugar the pill. What about his wife? What makes him angry regarding his wife? Not composing things my way. Not composing things my way. What about his children? What makes him angry with his children? When they don't trust me, when they don't open up to me, when they have secretiveness. What does he do when he gets angry with his children? I get sulky, yet he's easily off with his sulkiness, because it's not right to be sulky to your children. What about his patients? What makes him angry? I get angry from cunningness, from slyness, when they don't trust me, his patients, when they accuse other dentists to me. What about his sister? What makes him angry with his sister? When putting common obligations regarding their parents on his back, when his sister, instead of doing her obligations to their parents, he puts them on his back. The doctor evaluates this patient as being coward, 2 to 3. He is easily offended, 2, yet he never reacts to strangers. He is introvert regarding personal matters, regarding talking about his personal matters. Introvert 2 or 3. He speaks about his personal affairs only to his wife, but then he speaks about all of it to his wife. Better consolation 1 to 2. Aversion, pity 1. What about fears? He is afraid of financial matters. His fears have to do with financial matters. He is worried about his financial matters. Although he doesn't have much problem. Insecurity. He has a certain kind of insecurity. He is very much afraid of bankruptcy. Although this is not an objective fear. His financial are not so bad. He is afraid of Nazis, German Nazis, and people nowadays that follow the Nazi ideology. Obsessions. 1. He eats his nails. Obsession ones mean that whenever he goes out of the house or out of his office or leaves his car, he starts thinking, having second thoughts, whether he has left the door open. He eats his nails out of restlessness. He is superstitious 1 to 2. He's got muscle tension to the neck at grade 2. He does imaginary dialogues. He starts thinking, what if this person tells me this or that? And there is a contradiction. Then I must answer him like this or like that. He has this scenario in his mind, and he does these imaginary dialogues, how to answer to people with which he has contradictions. What about books? He reads books a lot. Books that have to do with philosophy, grade 2, with politics, with psychology, grade 2. Lately he reads Spanish literature. He reads and he translates these Spanish literature books or parts of books. He reads about Hebrew mystical philosophy, Jewish mystical philosophy. He writes critics and comments on films that he has watched, and then he forwards these comments to others through Facebook, through the social media. He is an active member of the Ornithology Association. He would like to teach literature. He is a dentist, yet he would like to teach literature. He writes critics and translations. He translates things and he forwards them to blogs at the internet. He considers himself smart too, yet because he has no good memory and he's not quick-witted to answer back easily and right away, so he is afraid of doing mistakes during a discussion, and he will spoil his image to others. He's very concerned about his image towards others. He has a great amount of anxiety before a presentation, 2 to 3. Yet when he starts the presentation, after 1 or 2 minutes of starting to talk, he gets over it and he is quite fluent. He eats very quickly. He literally doesn't chew his food at all. He has been doing that his whole life. He is easily distended, 2 to 3, especially when he eats beans. 2 to 3. When he eats late at night, after 11 o'clock, for example, he has much trouble and dyspepsia, indigestion. He is indecisive, 3, indecision 3. He thinks a lot about this aspect of the problem, that aspect, and in the end he doesn't get any decision. What about sex? He has many things about sex. He has talked about it, he himself, although the doctor didn't ask him out of discretion. He himself talked about it, although the doctor that took the case is a friend of his and of his wife. Yet, because he has, this dentist has come to my lectures on homeopathy, he is a student of mine, and another student of mine that was more progressed took the case, just because he knew that what he had, his behavior to the sexual sphere, to the sexual field, was interesting and important. He himself referred to it, although the doctor didn't ask him, the doctor that took the case. So he said that sex is something very important to him, that he has quite a desire, that he takes much care during the sexual act to satisfy his companion, his wife, and to satisfy her first, and then he comes also. In the past, and at times he has early ejaculation. Although he doesn't cheat on his wife, he is very keen on seeing other women, on watching other women in a sexual way. Yet, he doesn't go forth to cheat on his wife. These are the notes of the doctor that took the case. How do we proceed the analysis? First of all, we see the background. We have a dentist, 53 years old, male, married with 3 children, married since he met his wife at the university. She was studying also. She was also a dentist. And since the university, he is 53 years old. He had his first child 24 years ago. That is 24. Quite early, he had a steady relation with his wife, whom he married later, and they ever since have a an unspoiled marriage, and they have 3 children. He is a person that, apart from his work as a dentist, he is very active intellectually. He reads many books, philosophy, psychology, politics, Spanish literature. He even translates from Spanish, and not only he translates, he also writes critiques and comments on films that he saw, and he forwards all this material to blogs on the internet, to social media, and so on. Moreover, he would like to teach literature, although he's a dentist. And he's an active member of the Ornithology Association. So you see, we have to do with a very intellectual person. Not only theoretically, but he's active also. He wants to write things, to read things, to teach things to others, to communicate with others intellectually. He's a person that has dealt a lot with his father and is very much bothered and troubled by things that he has to do, by his obligations. This is the background of this person. Now, the next thing is to go and find miasmatically with what person do we have to do. Even before talking about the miasms, even from the length of this case and from his words, we have to do with an intellectual person, a very intellectual person. This is also clear from the words that he uses, from the manner of his speech, from the status of his speech. He has a very intellectual and complicated speech. He is a very cultured person, and tries to use cultured expressions, complicated language, advanced words, meanings, ideas, and language. For example, had so much to administer. A usual person would say, have so much to do, not to administer. I tried to translate exactly the words that he used in Greek and tried to find the exact cultured, similar cultured expressions in English. Not easy for me because English is not my mother tongue. Yet, I tried to find colloquial expressions, fine, refined expressions. Had so much to administer. Daily affairs. Crisis of irritability. Nobody uses such language in everyday discussion. Of course, he is a dentist, and someone could say that this is a medical expression. But even in medical expression, it's not easy to use crisis of irritability. when adverse conditions happen, adverse conditions, he talks about not finding things where he put them, that he gets angry when he doesn't find things when he put them, and he uses the expression when adverse conditions happen. Instead of telling right away what makes you angry, when I don't find things where I put them. This is a direct expression. Instead, he says, he uses a theoretical general sentence when adverse conditions happen, and you expect that something quite important happens. Yet, when he is pushed by the doctor to answer, to give an example of what he means by this general theoretical sentence, he says, not finding things where he put them. You see, we have to do with an intellectual guy. A guy that tends to speak a lot and speak generally, philosophically, with colloquial phrases, with refined language, with progressed language. He projects the image of the cultured person. That's the conclusion. Let's see more of it. Don't want to intrude myself into contradictions. Don't want to intrude myself into contradictions. Instead of saying simply, I don't want to get in trouble, to have fights with others, to intrude myself into contradictions. He uses phrases that are not easily used. Not when his wife, not composing things my way. Instead of simply saying, not doing things my way, not putting things my way in the place I want, not composing. About children, when secretiveness. I don't know if it is a colloquial and not easily used phrase in English, but he used in Greek a very rare term about being secretive, his children. What about his patience? Cunningness, slyness. About his sister, he gets angry from common obligations. What are your fears? Insecurity. Financial insecurity. He doesn't say, I don't have, when I don't have money. He said, financial fears. Bankruptcy. He is not straight. He uses many abstract ideas instead of using straight expressions, using verbs. He doesn't say, I am afraid to go bankrupt. He says, I'm afraid of bankruptcy. I'm afraid of insecurity. Not quick-witted. So, you see, these confirm that he's a very intellectual person, that he's fond of being intellectual, that he is very systematic and very thorough in order to be intellectual, to know things, and he doesn't only want to know things, but he has a lot of, he's very active in expressing to others and showing off in an intellectual way, in a psoric way, his intellectuality, his image. He is very fond of his image, but what kind of image? The image of the cultured person, of the refined person, of the worthwhile person spiritually, of the calm person, of the democratic person that wants to discuss. So, the essence of this person is his intellectuality, and as we will see, his cowardice. He is very intellectual, very caring much about his image, a psoric kind of image, and very concerned about his obligations, very worried about his obligations, and although he easily gets angry, he doesn't express it. Although he is easily offended, he doesn't express it. He is very coward. He can only say something to his own only, react and express his anger to his own, but not much. From what we have said, there is a great possibility that he is very psoric. Let's try to confirm this. He is not psychotic. If he was psychotic, he would have expressed his anger all the time, easily. He would have been not coward and not intellectual. Psychotic people are not intellectual. They are more physical types. And they are very strong and without any fears. And his way of dealing with sex is not psychotic. It's a psoric way of dealing with sex. He's very insecure towards sex. And that's why, although he wants to have he looks at other women and he would like to have many relations and he would like to cheat on his wife. He's so afraid of spoiling his image to others and to his wife and of being beaten by his wife that he doesn't go towards a relation, an extramarital relation. Is he syphilitic or psychotic? One could say that since he cares so much about his image and he projects his refinement and culture, he is very egoistic and he must be a platina person, a syphilitic person. But then, if we examine things, he is coward. He thinks he is smart because he has read a lot and he knows many things, but he is coward towards showing off because he has not good memory and he is not quick-witted. So he is afraid of doing mistakes and spoiling his image. This is not a syphilitic case. This is not a syphilitic behavior. Syphilitic people, even if they haven't read much, even if they are not quick-witted, they've got, they are very self-assured. They believe they worth a lot, and they don't have trouble finding ways to show off. A syphilitic person would have been more self-assured. A syphilitic person would express his anger in many ways. A syphilitic person would not be manipulated by his sister. His sister manages to put on his shoulder the burdens, the common burdens that they had with his father and mother. A syphilitic person would manipulate his wife and his children. His whole behavior is psoric. Let's examine it. He has a steady marriage the last 30 years. He doesn't cheat on his wife because he's coward. This is a psoric condition. Because he has much to do, he has anxiety and insomnia the last 20 days, not because he was very emotionally affected by the disease, chronic disease and death of his father, but because, as he says, he had much to administer, thinking about daily affairs. He doesn't have insomnia after the death of his father or anxiety because he is emotionally hurt from the death of his father. Because he is the intellectual guy. Because this leads us towards the constitutional picture of Lycopodium. Lycopodium is a psoric constitution, quite psoric. And Lycopodium is very intellectual and less emotional. He has a great mind. He examines all things all the time, and that's why he's not so emotional. That's why, although his father died the last 20 days ago, and although he was diseased for some time, he develops insomnia that has to do about thinking about his obligations and daily affairs. He had so much to administer. He doesn't say, "Oh, I've lost my father. Why? I'm so disappointed, I'm so hurt." Nothing. Only intellectual consequences. No emotional consequence. He is not insensitive, he is simply intellectual. Other things that show that he is predominantly psoric. He has this, he talks about crisis of irritability, and one would expect that he breaks things, he shouts a lot, he hits people. This is what one could say crisis of irritability, break things, shout all the time, but instead he says that he gets angry only when pressed by things to administer and by daily affairs, and only to his own. Cowardice. Only to his own. Afraid of contradictions. Avoids contradictions by all means. He says, I get angry easily, yet don't express myself, don't want to intrude myself into contradictions, so in the end, I sugar the pill. What does this mean? That something happens, he gets angry inside, and although he is not unjust with others, others may manipulate him or press him, although he is right, he sugars the pill with philosophy. He says, okay, he has hurt me, he has done injustice to me, but let's leave it. Let's drop it. Life is too short to have so many burdens. It doesn't worth it. People are so mean. I have to philosophize. I have to be calm because I have many obligations. So he finds so many intellectual excuses, and he's so good at it only to cover his cowardice, only not to find himself in contradictions. He so much, he has such an aversion to contradictions. So he sugars the pill in an intellectual way. He finds excuses to the others, or he philosophizes only to have no contradiction. We ask him about his wife, what makes him angry, and he doesn't say anything that is worth discussing. The only thing that makes him angry towards his wife is not composing things his way, placing things his way. Maybe his wife a little bit sloppy, but nothing else. Only a psoic person would say nothing about his wife, even if they had problems. My supposition is that his wife has the upper hand, and he is the yes man. Although he covers this part with the image that he is happily married the last 30 years, they have a very good family, 3 good children, he is a dentist, a good citizen, a respected person of the society. But in the end, what happens is that his wife has the upper hand, and I may say that the children also have the upper hand. So he tries to serve all of them, and he is pleased to serve them and to keep up with his obligations towards his parents and towards his family and towards his patient. When the children don't trust him and don't open up to him, when they have secretiveness, how do we interpret this phrase? He is the intellectual guy, so he handles all things with democratic discussion. So whenever something happens with his children, when they want things or when they get angry, his children, he tries to discuss with them. He tries to be a Republican. He tries to have a dialogue with them. And when they don't trust him and don't open up to him, and they have secretiveness, he is bothered.